cancer, and I want to welcome you to our Facebook Live for the month of December on the topic of lymphedema. We are so excited to be with you, and we've been collecting questions over the last couple of weeks, and we're excited to get your questions. So throughout the program, please type your questions into our Facebook Live page, and we're going to answer as many of those as we can. And a really exciting element of today's program is that after we talk for a couple minutes, we're going to do a demo, and we're going to see how you would actually get your arm measured for a compression sleeve. And we'll learn a little bit about that. We'll see how it's done. We'll see what it looks like, and you'll have a chance to ask your questions. So we're really excited to be with you. I'm just coming back from San Antonio, been running around all over the place, and we're really excited to be able to share this information with you. I'm going to have a couple of guests with me tonight. We're really excited to have them here. We have Wilma Morgan-Hazelwood, who's the manager of the Lymphedema department at Holy Redeemer Hospital. And we also have Josh Levin from LympheDIVAs and Nadia Brown, who is a young advocate for living beyond breast cancer. And it also happens to be Nadia's birthday. So we want to wish her a happy birthday and thank her for being with us today. So we're going to get started in a couple minutes. For those of you who are just joining us, you have joined Living Beyond Breast Cancer's Facebook Live program. And we are discussing lymphedema this month, which we're really happy to do because we know this is something that's really under-discussed. And we're happy to be able to bring you some information, whether you have lymphedema or it's just something that you're concerned about, which a lot of people are very concerned about. Anyone who's had breast surgery really may have a concern about developing lymphedema over time. So we're just going to get started in a couple of minutes, and I think I'm going to ask Josh and Wilma to join me here on our stage here in Living Beyond Breast Cancer's conference room. So please join me. Thanks for being here, and thanks for being here. So for those of you who just joined us, I'm just going to introduce them again. This is Wilma Morgan-Hazelwood, who is the manager of the Lymphedema department at Holy Redeemer Hospital in Southampton, Pennsylvania, which is nearby, and Josh Levin from LympheDIVAs, which makes really beautiful lymphedema sleeves, and we're going to get to see one and talk about those. So thank you both for being here.
Thank you for inviting us.
So while we're polling for questions, why don't we just start by talking a little bit about what lymphedema is and what it has to do with breast cancer treatments.
Okay, lymphedema is just basically an accumulation of what we have is protein-enriched fluids in the subcutaneous of the actual tissues. With that, it also presents some edema and chronic kind of inflammation that also can lead to fibrosis of the tissues. In other words, it's just a swelling of a limb, chest, wall, or breast. And it's actually produced by an injury. We were talking about secondary lymphedema, which means it's an injury into the lymphatic system. And so that's how it's connected with the breast cancer. When you're having axillary nodes removed or radiation, things of that, that can also cause the cause of lymphedema.
And Wilma, so some people still get axillary lymph node dissection, quite a few people, but for people who get a sentinel node dissection, are they also at risk for lymphedema as well?
They are, but it really reduces the risk greatly. We were so excited years ago when that came. It's a wonderful way that we can actually target the actual lymph nodes that are actually produced and part of that actual cancer. And so with that, usually when you have a sentinel node bypass, you're talking anywhere from 1 to 4 nodes removed. Axillary usually taking level 2 and 3 of the axillary nodes. So actually what the statistics are usually finding right now is about anyone from 3 to 8% chance of having lymphedema with sentinel node bypass. When you have your axillary node dissection, it usually goes up to anywhere from 15 to 30.
And that's even, some of the studies are saying that's even up to 25 years after the surgical event. And it's also very important that even if you do have that sentinel node, to be aware of risk reduction practices to further reduce the risk of that initial onset. Staying ahead of it and making sure that you are doing what you can and what you're comfortable with to reduce your risk goes a very long way to helping prevent that initial onset of edema from starting.
Thanks so much, and thanks, Sandra, for joining us. Thanks, we see you're in our feed there. So just quickly, one question that we get a lot is, everyone has some swelling after surgery.
Sure.
How do you tell the difference between whether it's something you need to be worried about or it could be lymphedema?
And that's an excellent question because it does happen. Usually anywhere from 4 to, you're talking about almost 12 weeks after surgery. And then what we're usually looking at is just pure edema. The difference between edema and lymphedema is edema is an acute, lymphedema is going to be chronic. Edema is usually just regular fluid, and your lymphedema has that protein rich, which gives a different density into the actual area. And then as we know, edema is going to be able to dissipate. And we know lymphedema is going to be chronic but can be manageable. So usually the onset of true lymphedema usually can happen initially, but it usually comes between 6 months and 18 months after your initial surgery. Usually about 80% of the people who are going to have lymphedema will come within those month periods.
But it's still, so it sounds like it still can be a risk over time.
Exactly.
So something to be aware of. So I do have a question that I wanted to ask you, Josh. We have a Facebook question, so thank you so much. For those of you who are just joining us, please do send in your questions. We're going to answer as many of them as we can. So Sandra Boss Van Cleef says, I had axillary lymph nodes removed. The numbness and nerve sensitivity comes and goes in different levels of discomfort. Question, does massage help relieve that?
And sometimes it really does, Sandra. It's nice that you're also getting some sensation coming from the nerves, because that means they're actually firing, they're rebuilding, they're doing that connection. So don't be too alarmed by that. We also can sometimes have the massage that can help that, because what we call it's called obnoxious stimuli. So by actually giving enough stimuli, it calms down the nerves if you're having a lot of pain from that. So sometimes massage can really help in those aspects.
Thank you so much. Oh, sorry, go ahead,
I just
Josh.
want to say, and from the therapy perspective as well, there's standard massage, but then there's also manual lymphatic drainage as part of complete decongestive therapy, which is something that a trained lymphedema therapist can do, which does involve some massage, but really that it does require someone who is trained in this and can very much help greatly reduce the amount of edema that is in somebody's limb.
Thank you. Yes.
Thanks so much, Josh. In a couple of minutes, we're going to actually do a demo with Nadia where we're going to show how to measure for a sleeve. But before we jump into that, Josh, can you just talk a little bit about how sleeves are used as part of lymphedema treatment?
Absolutely. So they are a part of treatment. What's most important to remember about the sleeves is their job is not in reducing the edema. Their job is to manage it and maintain it and prevent it, or help prevent it from getting worse. It is only that hands-on therapy, the use of short stretch bandaging and multiple layer wrapping that can bring down somebody's edema. So wearing the compression sleeves is something that you can do to help prevent an initial onset, and also something that you wear in conjunction with treatment to maintain it so that it is not getting worse in between your visits to a therapist.
So how important is it to wear a lymphedema sleeve if you have lymphedema? Because I know sometimes we hear people don't get sleeves, or they don't have time, they don't have access. How important is it to wear one?
It's extremely important. It's the only thing that's actually going to keep your lymphedema down. Lymphedema, if it's not controlled, will continue to grow. I mean, that's the process of lymphedema. So it's one way of we can be able to manage that. It also helps and be able to protect that arm. You're at risk for infections for cellulitis, which is very damaging and a causing of the lymphatic system. So it's one area that if we know we can keep that lymphedema down, it actually decreases the risk of lymphedema. So because once it gets filled, it's almost like a sewage there, and we won't be able to control that and make it very healthy for you.
And Wilma, can you just explain what cellulitis is for those who might not know what it is?
Right. Cellulitis is actually an infection that goes directly onto the skin and directly underneath it. Unfortunately, where our receptors are for the lymphatic system, even though they go deep in the vascular system, the receptors that actually collect the fluid is directly underneath our skin. Mm-hmm. And unfortunately, that's where the infection is. And so we're worried about that because it actually is one of the areas of trigger that can cause lymphedema, is the cellulitis, because with that, you're damaging the receptors and also the vessels. Mm-hmm. And so that's why it's so important to keep that skin and area very healthy.
Thank you so much for answering that. So we're going to stand up now and we're going to do a little demo so that everybody can see what you would actually experience if you went to have your arm measured for a compression sleeve. So Nadia, please come on and join us. So the birthday girl is going to join us here. Thanks for being with us today, Nadia. Really appreciate having you here. And Wilma, so why don't you show us how you would do this and why you're doing the things that you do?
Right. What we decided with Nadia is she would be getting a compression arm sleeve at a compression rate of usually a class 1 or 20 to 30 millimeters of pressure, and also with a gauntlet. And the reason for the gauntlet is because we have no edema at this point into the hand, but we want to prevent it. We know where do we want that to happen. So the first measurement, we always measure in centimeters because we can get more exact. And so the first measurement we're going to give on the palm area is going to be 19.5.
And what I am doing here is taking the measurements that Wilma is doing and putting them into an app that we have on the LympheDIVAs website, where we are able to convert that circumferential measurement into an approximate amount of delivered compression so that we can make sure that the garment is starting within that 20 millimeters of mercury to 30 millimeters of mercury range, and make sure that it is graduating or getting less compression as it moves up the arm.
And why is that important, Josh?
Well, the way that these garments work is twofold. One is that they have a graduated amount of compression, where the most amount of compression on your limb is at the most distal or furthest point from the shoulder. So when we're looking at a 20 to 30 millimeter of mercury garment, we're looking at that it should start somewhere inside that range at the wrist and then get lighter. Things like to move from a high pressure environment to a low pressure environment, so that graduation helps promote the flow of the fluid in the arm back into the core, where the working lymphatics can pick it up. In addition, it's just adding overall pressure onto and inside the limb, and the lymphatic nodes and vessels that are in there have little one-way valves, and when you put the whole system under pressure, it makes it a little bit easier for those valves to take in, process, and then move it along. So those are the theories of what these garments are doing.
Right. If you have an area that's putting too much pressure, say on the forearm, it's going to push the fluid back down into the hand, and so that's exactly what we want to protect.
Great, thanks. So we're going to keep going, but I want to say to folks who are standing in your questions, awesome. As soon as we're done with this demo, we're going to get to your questions. So keep sending them in.
So we want the largest part of the wrist. We want to make sure you become right there at the bone. We're going to take the widest area of the forearm, and we're going to measure that at 29. And then we're going to take the largest area of the bicep, and we're going to put that in at 46. And then Josh is going to make sure we get the right size for you, make sure it's comfortable for you. We want to make sure that you have no pain. We have no numbness, no tingling. So we want to keep the sensation that it's not cutting off any kind of nerves, and that you can be comfortable to wear it. Okay. You're going to feel it's compressed, which is going to be comfortable. Believe it or not, the lymphatic limb likes to be compressed. It actually feels good. So don't worry.
Great.
So based on your measurements, I think that our class 1 medium would be best for her. What that's delivering is about 23 millimeters of mercury on her wrist. It drops down to about 20 on the forearm, and then drops down to about 15 on the bicep. And then we're pairing that with a medium gauntlet, which is giving her about 26 millimeters of mercury on her palm, which is greater than what she's getting at the wrist. So really going in the direction that we want it to go. But now that we know theoretically that it should be safe to wear and doing its job, let's get it on her limb and see if it's comfortable and is something that she can handle and want to wear.
That's great. So while we're putting the sleeve on Nadia, one question I had, we were talking about the fact that Nadia doesn't have much swelling right now.
Correct.
And is it important to be measured when you don't have swelling? Should you have the lymphedema treated first before you get measured, or how does that work?
Right, and we always recommend that you get your treatment first. We want to be down at the lowest point possible. That's what Josh was mentioning before. We need that complete decongestive therapy to happen. So we're looking at skincare, we're looking at exercise, we're looking at compression, and we usually do that with the compression low stretch wraps on doing that. And that's one thing that's really important. And also what we call the manual lymph drainage, which is a massage technique that actually stimulates the lymphatic system to actually drain. So that's really, once we know that's down, she is healthy, we have it at the lowest point, then we actually get the garments. And so, which actually she's wearing right now is what we call a daytime garment. and that's very important to know that. So, and doesn't she look stunning in not just her outfit, it's beautiful. And
It's a beautiful sleeve too. I mean, it looks sort of almost looks like a tattoo. It's so pretty.
And this is our yogi sleeve, where 25% of the cost of the garments goes right back to living beyond breast cancer.
Thank you very much. We really appreciate that.
Thank you, Josh.
It is a beautiful sleeve. And how does it feel, Nadia?
It feels very comfortable. It's not tight. It's like breathable. I can move my arm around.
And
I like it.
have you ever had a lymphedema sleeve before?
No, I never had a lymphedema sleeve before.
So how
This
would
is
you
really
feel
good.
about wearing something like this?
Well, it feels comfortable, so I'm excited to wear it, and hopefully I can get some compression in my arm.
That's
Yes.
great.
Yes.
I'm really glad to hear that. Thank you so much.
Thank you.
Thank you.
Thanks, Nadia.
And Nadia, these are for you, actually,
Oh,
to take home.
yeah, Nadia's gonna get to
That's your
keep
birthday
this
present.
sleeve.
Happy
Yeah,
birthday.
happy birthday. So thanks everyone. If you're just joining us, you were just seeing a demo of how we measure for a lymphedema sleeve, and you're at Living Beyond Breast Cancer's Ask the Expert for December on the issue of lymphedema and breast cancer. And we do have a bunch of questions, so we're going to just jump right into it. Thank you, Stephanie Walker, for your question. Stephanie asks, I have been symptomatic for about a year using compression garments and alternating compression machine with some results. Will it get better so I don't have to wear a sleeve?
And we really hope so. Initially, when we always, years ago, when you got lymphedema, you had lymphedema for life. And now we're finding some areas it actually can be reversible. And that's what we usually call a stage 1. A stage 1 means you have lymphedema and it will dissipate at one point, either through elevation or through time. The other thing is when we get into a stage 2, and then you have stage 2 as a chronic, that it stays the same as when you go to bed, when you wake up, you will have lymphedema. So usually if you've had it about and you're being able to control it, what we want you to do is be able to control it in a very comfortable way, that you can manage it, not having it progress anywhere, and that's the area that we're really looking at for you. So will it actually dissipate? You're going to be able to tell us that, and that's what we're looking for.
Thanks for answering that question. So our next question is from Amanda Caldwell Pfeiffer, who's asking, and this is actually a really common question. I was wondering if by having blood drawn from the arm that on the side where I had the lymph nodes removed, would that cause swelling that could resemble lymphedema?
Excellent question. We know at this point there is 4 areas that really we know that causes and heighten your way of actually getting lymphedema. And one is also the number of axillary nodes that you have removed. Number 2 is going to be radiation, and mostly radiation into the axillary areas of nodes. Number 3 is going to be obesity, and we can talk about that a little bit later of how that affects it. And 1 is going to be cellulitis. And this is the area we talked about a little bit of what is cellulitis and why it causes a lymphedema, but also these are the areas that you have to prevent it. And 1 is going to be the actual we usually talk about blood pressure, and we talk about having a needle stick or any kind of needles that go into that, mainly because we're worried about infection. So my guess is nowadays they're much more clean and pure, but if you ever run a risk and you don't have any problem with the other extremity, it's always best to use the other arm. Of course, if it's a life-threatening thing and you have to have it, that's fine. But what you wanted to do is prevent any kind of form of cellulitis forming it. But that actual stick itself, to be able to create lymphedema, is probably a little bit of a low cost.
Okay.
Yeah, I mean, it's really all about risk reduction. And there was a study that was put out a couple of years ago where they did look at needle sticks and blood pressure and what the impact and risk of lymphedema was with those. And the studies showed that there was relatively low risk, especially with the blood pressure. And they said the same with the needle stick, but they also raised the issue of cellulitis with that needle stick. And because of that very strong correlation between cellulitis and lymphedema, in general, it is still safe to say, why don't we try the other arm? And with the blood pressure, it's the same sort of thing, even though it is very low risk and that there isn't necessarily a study that shows a direct link. It's of the idea of saying it's not that difficult to try the other arm. You know, it's a very low impact request. So, you know, it's one of those things where, yes, the studies are showing that there might not be the risk that we once thought that there was, but it's also not a very big deal to say, hey, can I use my other limb?
Yeah,
Exactly.
yeah, and if both sides are affected, because this comes up as well, you can have your blood pressure taken on your leg.
And yes, we
So-
recommend that.
And
It's
blood
very
draws as well.
common.
Not as easy, but
It can
doable.
be done.
Yeah. Our next question is from Victoria Rego. Thanks so much for your questions, Victoria. How important is exercise in preventing and maintaining lymphedema?
It's actually very important, and that's why it's one of the parts of complete decongestive therapy. The lymphatic system, even though it's part of our vascular system, it does not run and travel with the beat of the heart. It actually travels by the pumping of a muscle. So we need that muscle to be pumping to actually move that lymphatic system. So the problem is the contrast as to how much exercise you do, because the more you exercise, the more you actually pump in more fluid into an area that might have trouble actually getting the fluid out. But we know if we don't exercise, then we don't have that ability to actually move the fluid as it can be. So that's another reason why we always say wear your sleeve also when you're exercising, because it will enhance that compression, will enhance that pumping, and make exercise that much more effective for you. But that's where exercise is so important for the lymphatics.
And also making sure that you're doing the exercises properly. There was an excellent study done through the University of Pennsylvania called the PAL study, which was really the first one that overturned the myth that you should not be lifting weights, and that weightlifting and lifting heavy things is dangerous. Yes, there is a risk in using heavy weights with an arm that is at risk, but building up from a very low weight with proper supervision, using proper form, all of that is strengthening that arm and doing all those wonderful things that we were just talking about that can help improve the lymphatic system as a whole.
So that actually proved that weightlifting does not cause lymphedema and it does not increase lymphedema, as long as it's done in a very slow process way.
And what type of person could show you how to do the exercises properly?
Well,
you guys can arm wrestle if you want to answer that question.
Yes. Actually, in doing that. Actually, if you actually go into the website of the PAL study, you can find that online. They actually have that. They actually have a program that can actually be done. And also, you really want to make sure you do that with a lymphedema therapist to be able to carry through with that. But it's a wonderful study. It is online. Please read it. And the exercises that are also given there, and they actually be able to have it. So it's very, very good.
And you can actually get some information about the PAL study at lbbc.org because we've written about it.
Another thing we talk about exercise is also stretching. That is so important, mostly when we're talking with the breast cancer, because we really want to get this area, this axillary area can get so tight with the surgery alone, with the radiation that wants to keep on pulling it down. So it's a nice, that long stretch. We talked about that a little bit. We went over with Nadia a little bit to make sure you keep up those long stretches. Climbing that wall is important. But with anything else, with any of the exercises you're doing for lymphedema, you don't want to do a constant repetitive. We don't want this pumping. We're not building strength. What we're building for is that long, long stretch. That's going to give memory to your muscles. That's going to give that beautiful stretch to keep this area open. We want this area to flow, to be able to drain properly. And so once it gets bound, we don't want this to go down into the arm. So we do those beautiful long stretches. Yoga is beautiful for that reason, also for exercise, because it gives you that beautiful long stretch. We don't believe in pain. So if you're having pain in the stretch, reduce that a little bit. But get that long stretch to be able to rebound those muscles and to really help them move.
Great, thank you. So I'm going to take our next question, and for anyone who may be just joining us and wondering what we're talking about, this is Living Beyond Breast Cancer's Facebook Live Ask the Expert on the issue of lymphedema and breast cancer. Please send in your questions and we'll answer as many as we can. And I want to thank Francis Haddock for your question. When is it useful to get a sleeve? How soon after surgery? After having 34 nodes removed, I'm concerned about edema.
I might be a bad one to ask for that. I actually believe, and the theory is, if it's not broken, don't fix it. So if you're showing no forms of lymphedema, nothing into the breast, nothing into the chest wall, nothing into the arm, if you've had fleeting lymphedema for a week or so and it dissipates, then you're at risk. But if you show no signs of lymphedema, you sometimes can do more harm if that sleeve is not fitted correctly. So usually I recommend not using a sleeve unless you have any forms, or unless your physician or your therapist is recommending it for other reasons. That's certainly been hidden. But we worry about making sure how you're using it, if it's fit right, to be able to handle that.
Yeah, and making sure that it is fit right is the most important thing here. Making sure that the graduation is going appropriately, that you're getting the right amounts, and it is important to talk about it with your therapist if you have one, or with your physician, as to whether or not they believe that this piece of the risk reduction process is something that you should be doing or shouldn't be doing.
Great, thanks. So I'm actually going to take a question that was sent in advance, and I want to thank, there's a number of you who did that. Mary had written to us that she's still developing cording over a year after a lumpectomy and lymph node dissection. I'm in treatment and wear compression garments. What's the cause? And if you could also explain what cording is, I think that would be helpful.
Correct. Mary, it's wonderful, and if I can tell you the cause, I would be a millionaire. I really wish we could. The technical term for cording is axillary web syndrome. We call it a syndrome because we do not know why. We know it's most women after breast surgery, probably 70% will develop cording. Usually it dissipates on its own very quickly, and some do not. But it's usually what we usually see the most. People coordinate cording with lymphedema. It is not. Cording is just because you have cording that you do not develop lymphedema, which is nice to know. It's not at a high risk for that. It's actually an inflammatory into the actual lymph vessel. Initially, we thought it was more in the vascular area because the cording can get quite large, but it is actually an inflammatory process along the cording. So what we want to do is to be able to stretch that. And you can get lymphedema many times over. Sometimes you can get the cording. We can actually get that stretched and your cording will dissipate, and then all of a sudden will come back again. So that's one area that we really, for you, we recommend you to do those long stretches. That is what's actually going to be able to get those cords to be stretched. We used to try to break them, which we don't do anymore. And we believe that long stretching is what's really appropriate. You can also go to a lymphedema therapist who are all trained in doing handling cording for that reason, to be able to have that help. Because it is very painful, it's very limiting in your range of motion, and it's very scary.
And it's just further makes it important that when you do see a therapist to make sure that either PT or OT is a trained and certified lymphedema therapist as well.
Oh, I pay money for that. So what you're actually going to be looking for is some initials after a name.
Yeah.
So you're looking for what we call a CLT, where it's a certified lymphedema therapist. And that's where you know they've actually have graduated from a lymphedema school, and they have at least 135 hours of education into the lymphedema. Then the other thing that's very important next to it is you want to look for the initials LANA, which is LANA. And that means they actually have taken and sat for our registration examination to know they have been certified, and they have gone that extra mile. Years ago, you could actually take a course for one day and call yourself a lymphedema therapist. Now we've become much more educated, and that's why LANA was formed. So we actually know you're getting somebody who has been in an accredited school, have at least 135 hours of education, and has been able to sit for the national exam.
Great, thank you. So I'm going to take our next question that was sent in advance from Debbie. I have lymphedema after a lumpectomy on my right side. I want a breast reduction so my breasts match. What is the risk of getting lymphedema after a breast reduction surgery?
Actually, Debbie, there isn't, which is what we're really happy for. Because your injury is occurring on the one side, you're having the non-cancerous breast to be actually in full reduction. We have wonderful, our body is set beautifully with what we call watersheds. And actually they form down the center of the sternum, on the middle of your back, down at your waist. And so because of the watersheds, lymphedema cannot travel from one side of the body to the other, and it cannot travel from the arm down to the leg. So you might get edema in that breast after, just as you would normally, because it's been injured, it's going to be protected, but it won't become lymphedema. It can never travel from one side to the other. Our body protects us from that. So it's a great question.
Thanks. And while we're looking for a couple more questions, I wanted to ask you, Josh, a little bit. I mean, the sleeve is so beautiful, and you have all these beautiful designs. Why was LympheDIVAs founded, and why do you make these sleeves beautiful in this way?
So this all began with my sister Rachel. She had breast cancer starting at diagnosis just before her 35th birthday, and that led to an axillary node dissection, radiation, and it was only a few months after she had finished her radiation therapy that she felt the feelings of heaviness in her at-risk arm. And luckily, she was being seen at University of Pennsylvania with Dr. Andrea Cheville, who is now at the Mayo Clinic, and a very quick diagnosis of lymphedema. And when she went to get her first sleeve, it was just not something she wanted to wear. And it was only beige, and it was in this fabric that was thick and heavy and hot. And she just said no. And so she started LympheDIVAs to make a garment that she would actually want to wear. And so for her, that was making it feel like sports compression, so moisture wicking and breathable, but making sure it is also the true medical grade graduated compression, and then making it pretty. So we had solid colors at first. We were the first company to do that. We were the first company to offer a darker skin tone, and then we became the first company to offer patterns. And that's really been our main focus, is in designing and developing and applying beautiful patterns to these so that people can get some ownership over this disease and get some control over their body and over how they're going to deal with this and live with this.
I really appreciate you sharing Rachel's story, and I think it's really important because we hear so much over time from people who are really uncomfortable with lymphedema and feel embarrassed, don't want to go out, and having a sleeve that looks beautiful makes you feel more motivated to use it and more comfortable and more yourself. So if you want to learn more about that, please go online and learn more about that. And so we've only got a couple more minutes. I'm not sure we're going to get to any more questions, but one thing I wanted to mention is that all of us here on the stage, including Living Beyond Breast Cancer, are supporters of the Lymphedema Treatment Act, and we happen to be doing this program this week, and the timing is great because this legislation, which will help people on Medicare get access to compression supplies, is being discussed on the floor this week. And I think I'm going to let Wilma talk a little bit more about that.
It's something that we have been trying for so long because we know Medicare, unfortunately, does not cover. It covers your therapy. It does not cover any kind of compression garments whatsoever. And we know a life of a compression garment is 6 months. So they're very expensive, and you have to have them at least every 4 to 6 months, a brand new one to come. And that's the area that we have such issues with. It's coming to the Hill. We're so excited. Please call your congressman, your senators. We want this to be passed. Numbers matter. You matter. If you tell them how you feel, we're all going to be 65 at one point, and you're not going to be able to get your garments. And this is an issue that's very dear to our heart. We go and we march on Washington once a year to talk to all the congressmen, and we're so close to it at this point. So please, within the next 4 days, if you can actually call, get that numbers up. So when the vote comes in, we can actually say, yes, we want the Lymphedema Treatment Act to be passed.
Yeah, and if you're looking for information about that, you can go to lymphedema-treatmentact.org, and we'll type that into the Facebook Live comments. So unfortunately, our 30 minutes are over, but I want to thank all of you for participating in the program and for sending in your questions. And this has been a great conversation, so I want to thank Wilma, Josh, and Nadia, and wish her a happy birthday, and wish all of you a great night and wonderful holiday season.
Thank you.
Thank you.
Thanks
for
coming.
Absolute pleasure.
Yes, great.